Hey everyone, welcome to our Winter Wellness Celebration. This is our first live stream with a treatment demonstration. Today we have Josh,
Boom.
who's coming in for his Alma TED treatment.
This is my third session?
Third session. So TED is used for hair restoration, helps to open up the hair follicles, and we drive in a hair restoration serum. And we've been having great success, especially with Josh here. So we're going to begin. First thing we do is we're going to prime, and then we'll apply the serum. And we can treat up to 5 different locations on the scalp. So you ready, Josh?
I'm ready.
All
That's a
right.
great intro. I should have recorded all that.
All right, here we go.
Ooh. Extremely painful.
Extremely
Stop
painful.
it.
No, not painful.
There we go. That's prime first.
So what's happening right now? It's priming, you
So
said?
right now the device is priming,
Okay.
so we can, and we're ready to start.
Boom. So hey, just repeating, we're here at Warrior Medical. This is my third time using the Alma device, laser, for trying to fix the thinning hair back there. And so, what made me so excited about this, right? Because as you're losing your hair, it's a big thing. It's a big part of your identity. And so, if there's a way to push that off, obviously you want options to do that. And so, I tried a bunch of different things. And so, I started to look at maybe doing the graft or the surgery and go to Turkey or go somewhere and spend the $5 to $10 grand to go through that process. And it's a pretty in-depth process, and it takes about a year to for the healing and everything to happen. And then sometimes you have to be on medications for the rest of your life. And as somebody who tends to have the reactions, whatever the reactions are to the medications, I tend to get those. And so I try to avoid medications as much as possible. And so once Dr. Tim told me about this, I was like, yeah, man, let's see what we can do. And so we've already been able to see some little hair growth, and this is just the third session. And I think usually, right? Correct me if I'm wrong, Doctor. Usually you do 4 sessions to start. Is that right?
3 sessions.
3 sessions to start. Once a month.
Once a month.
And then after that, it's as needed, or what do you suggest?
It's as needed. We can do touch-ups about every 6 months as well. And so what we're doing right now is we're just priming the scalp in one of the treatment areas. It's a 2-minute prime, and then we're going to apply a hair growth solution and then drive it into the scalp. So Josh, what are you feeling right now as we're priming your skin?
It feels like a massage. I could go to sleep, to be honest.
So it's a little buzzing sensation and
Yeah, but not like a drill, not like the dentist. It's like the opposite of the dentist. Like I look forward to coming here. I don't really look forward to the dentist. No offense, all you dentists out there.
so that was just 2 minutes of priming. Now we're going to apply a solution.
You just made me think of the Seinfeld episode where they talk about being an anti-dentite.
An anti-dentite.
Yeah, like,
Seinfeld episode?
yeah, it's hilarious.
That would be me.
Yeah, you're an anti-dentite. How dare you?
I know.
It was like they were saying that they basically had they were like profiling against dentists, and yeah, it was just a really funny episode.
Well, I know we're talking about hair, Doctor
Mhm.
Tim, but one of the reasons I come to Warrior Medical and work with Dr. Tim is because I've always been the person to avoid doctors. I've always been the person to avoid dentists, and so having a personal relationship with someone that I can just message. If I get sick, if I have problems, having like a consultant. And so I pay a monthly fee to work with Dr. Tim on a regular basis, and it's been the best decision ever. So, sorry, I don't know if you want to promote that or not. But
Oh, absolutely. I mean,
that's my favorite
that's
thing.
what our practice is about. So we'll get that in just a second here. So next, we're going to now drive the serum in another 2 minutes. So here we go. So right now we're driving that serum in using some ultrasound technology to really get into those hair follicles. So Josh, you mentioned about having a relationship with your doctor. And this day and age, it's really hard to do. When you go to a doctor's office, a doc is typically running 30, 40 minutes behind, and you're already asked to show up about 15 minutes early. So now you're being even more behind. You walk in, and the medical assistant starts asking you all these questions. Nothing to do with your visit today. It's fulfilling some metric somewhere by the insurance companies, by the hospital system. So your 20-minute appointment now is down to about 10 minutes. Doc finally comes in the office or into the exam room, and now it's okay. Only have time for one complaint. What's going on? Well, Doc, I have 5 things I need to talk about. I'm sorry, you have to come back. I mean, that's not good medicine. You've created a system where patients and docs no longer connect. It's factory style. It's getting them in, turf them, and chasing those insurance dollars. We stepped away from all that to become what we call direct primary care, so we can spend time with our patients and develop a relationship. Josh, will text me, hey, this is what's going on. Do I need to come in? Or no, we have a relationship. I know this is your normal, say, sinus infection for the year, so let's just treat you. We have that relationship. I can respond pretty quickly, emails, text messages, phone calls, and bring them in if I need to. But if we can handle stuff out without wasting everyone's time, we will. And by doing this, we can also save healthcare dollars because I can spend more time with each patient and develop that relationship and take care of all those needs all at once. Does that sound about accurate, Josh?
Yeah, I mean, as somebody, right, everyone who knows me, like, I'm hustling, I'm always doing like a million things, and so to have something like you're saying, a sinus infection or reaction where I don't have to go to urgent care, I literally can send a text, take a picture, and you're like, oh yeah, we know exactly what this is, call on a subscription and go get it within the hour or two. That, I mean, for me, that's the most amazing thing.
I do have a couple questions
Sure.
from the live feed. Dom T is asking, what is the serum, he put in quotes?
The serum, it's a proprietary blend. It's very much a lot of nutrients that do really well for hair growth. That's all I can really say about it, since I said
It's proprietary, gotcha.
Yep.
Who makes the serum?
It is through a company. It's supplied by Alma, our laser company and device company, through a manufacturer over in Europe, I believe, who's the leading in hair restoration.
But Alma is who makes it.
Yes.
Alma produces it, okay, cool. And then, Josh, we have a lovely, lady from India who wants to make sure I let you know that she thinks you're extremely handsome.
Thank you so much.
And
What's
if you're
your name?
interested, she'd like your number, so we'll take that offline later, but you've got a fan.
Thank you. My wife isn't a huge
Your
fan of
your
me
wife is not a huge
passing out
fan
numbers.
of having affairs, that's
No,
good.
She
That
loves
sounds
when other people think I'm attractive, so
That's
she
cool.
appreciates that.
All right, Shivansh, I'm sorry if I'm mispronouncing your name, but Josh is a married man, so.
Yeah, I'm not wearing a ring.
But now we know your type, so we'll look for Josh's twin and let you know when we find
I'll
him.
look for my doppelganger.
Your doppelganger, yes. So cute. All right, those were my 2 questions so far.
Questions? Okay.
She says, okay, sorry. No, don't be sorry, it's a compliment. So sweet of you.
It's amazing. Even with the white mustache. That's pretty great.
Cool.
So even like one of the other things that Dr. Tim has even helped me out with is like I get such bad rosacea and what's the other one? Eczema. And so I like, if I go drive now, I put sunscreen on and I just have to really take care of my skin. But so one time I had, sometimes the reactions get so bad, like insane, like I can't even leave the house. And so to be able to just get a subscription for that immediately, because I try not to use antibiotics as much as possible, but sometimes like, you
You have to, right?
And so he sent me in something for that right away. And so that's, those things are so helpful because to go to urgent care, like it's hard. Sometimes I think people neglect their health
Because they don't want to deal with it.
because work is such a huge priority, and it's like,
Right?
I'll deal with this minor.
Yeah, I'm gonna tell my
inconvenience
boss
and
again that
suffering.
I'm gonna go sit in a waiting room for 5 or 6
Exactly.
hours, and they're like, "Dude, get your stuff together. I
And who
need you to
wants do
work."
that?
Right,
To
right.
be told that I'm gonna give you some aspirin and send you home, like,
Yeah.
know. So it could be a big problem, but I think a lot of times people in my position and colleagues and friends of mine will just push things off. And we know that things you avoid can end up becoming bigger problems. But a lot of times you just wait till the problem's massive to take care of it. So having a primary care doctor and having someone that you can message that you have a relationship with, it takes care of all those little things so fast. And if anything big ever does comes up, at least you have someone now you trust and you have a relationship with.
Yeah.
Yep. And the way today's medical system is set up, even when we look at Medicare, it was never meant for preventive visits. It was all reactionary medicine. And what we're finding is that if we can prevent, or even prevent, treat early, we have a lot better outcomes. And all that does come from an open, honest communication
Sure.
with your doctor, your nurse practitioner, your clinician.
Yeah, that's something too. Like, you know, Dr. Tim probably knows too much stuff about me, but it's nice to have one person that you get to talk through stuff with.
Well, and from my perspective, you have a solid baseline, right? So if anything does come up, they're gonna know you enough to know, yeah, this is really odd for you, and be able to help catch stuff early that might be something that the traditional medical system wouldn't be catching.
Yeah, and a lot of times, today's medical practices are so incredibly busy. Who knows who you're seeing? It's not your normal doc. It's a nurse practitioner who's there for the day. So it's really hard to develop that continuity of care.
Yep, yep.
I used to work for the healthcare system, and my next same day appointment was 3 weeks away.
Wow.
And how is that helpful for anybody? You're sick now. I'm telling you, can't see you for 3 weeks. Go to urgent care, waste more money.
Yeah, I might be dead in 3 weeks.
Yeah.
Look, I'm not joking. If you like pneumonia or something, you know?
Or my next regular visit is 6 months away, but you need to be seeing in 3 months to follow up on a chronic condition. So the system is broken, and through our practice with the direct primary care, we're trying to start a little healthcare revolution. Bring patients back in, bring doctors back in, and not be controlled by these other entities, the insurance companies, the healthcare systems, hospital systems. Right. So we're gonna do another area here, we're gonna prime again.
So just tell us a little bit, you already primed the area we just worked on, right? And
So-
then you applied the treatment to that area, correct?
Yep, so we've done 2 treatment areas so far. So we do 2 minutes of priming, apply the serum, and then another 2 minutes to drive the serum in. So we're on area number 3, we're priming area number 3. Again, not painful, it's just a little buzzing. Josh describes it as a massage.
It
Oh,
does
sounds
like a
lovely.
Yeah.
That's all yeah. It's great.
Now I wanna do it.
It's like hard to think about what to write on this post. That's it.
And this is not just for
Oh,
men.
you're like relaxed enough where you're
Yeah,
like,
yeah,
I'm
yeah.
having a hard time focusing.
Sorry to fall
I
asleep.
like could feel like,
Maybe I just don't
I mean, that's a
sleep
good
enough.
thing, right? I mean, that's not a bad thing to feel like you're feeling so
I do
relaxed.
this every day if I could.
That's awesome. I got my hair just shampooed and done the other day, and I was like in the chair, like I could fall asleep right now. Something about the scalp and
Oh, yeah.
relaxing.
So I'm a massage therapist too, so I do.
Oh, do you? Are you really?
Yeah, so I do. I do personal training, and massage therapy, and they go together.
Oh, that's so cool.
What's
I
your
could see
massage
that.
therapy company?
It's called Melt.
Melt.
Melt Therapeutics. Yeah, because like my whole philosophy, I think a lot of times people do deep tissue massage, which I'm sure there's a place, but my philosophy is that stress seems to be the #1 reason why people have knots. Stress is a psychological response, and then holding your muscle or holding tension in a specific place to where it builds up tightness. Okay, so that's your sympathetic nervous system staying on and not turning off. Massage puts you out of that, right? Puts you into your parasympathetic nervous system, so that's rest and digestion. And when your body starts to go to that place, all your muscles naturally start to relax. So what I try to do is I'm trying to coax the muscle to relax, not force it.
That's
And so
interesting.
my goal is always, like, there's still times, trigger point, there's still times where you gotta do a little more pressure, but I try to put people into this place where they're almost asleep and their body almost opens up to allow me to then work on it.
Right.
Versus if I'm doing so much pressure that you're barely catching your breath, you're actually fighting me. Your body's
Right.
starting to
You're now
retense
you're causing more stress.
Yeah,
On
and
a
so
way. Yeah.
I'm really pretty anti deep tissue for the general public.
Interesting, because that's what I always ask for because I feel like that's what I need.
Yeah.
Because I carry so much tension and stress in my shoulders and back.
So this.
So
as a
you're
personal-
selling me right
yeah.
now. I didn't know any of this about you. So
Well,
this is interesting.
The other thing is that massage, if it is for stress, that should be something you do on a weekly to monthly basis, and then anything outside of that is a postural or strengthening it. So, if your traps are overly tight, which is what everyone's are, It's because your rhomboids are a little bit weak. It's because you sit for work, and a little bit of that is just changing your posture. Which of course nobody does that, but
Right.
that's what
We
we're
can try.
We can
I mean, I work, I try to have an elevated desk, so I'm more like this
That is
on the
helpful, yeah.
computer versus hunched over. Cause I found for years, like I was
Yes.
you know, you're sitting a lot. And I also love a good up and down desk.
Yeah.
They're a little, you know, pricey, but it helps with posture and you can stand for part of the day and kind of feel a little more energized. So, cause I do this all day, what you're seeing me do, either on the phone or the laptop. Yeah.
So
No, you can talk.
You said that
Really great.
you try to get the body to relax itself in the
Really?
massage.
Yeah, that's my whole goal.
So doing the whole muscle energy idea.
They're,
That's good to
one of the
know. I
ways
mean, it might
works
be
is,
like a
the
little,
back has the
I don't know
most
if it's
sensory
Christmas present
units.
appropriate,
So
but
usually
maybe.
if you take care of it's like this, right? This is such a light thing, but it's a very consistent pressure and sensation. And it's almost like puts you into this meditative state. And so I can tell I'm starting to just, whatever the cares of life are starting to just, it's almost like a drug. I'm like starting to not care, but it's a healthy drug. And so it puts you in this state where it gives your brain time to relax and recover. And so I think that's what I think massage, the biggest benefit is actually what it does to your mental state and your mental health. I think what it does for muscle, unless you're a professional athlete, I think that is almost secondary.
Mhm.
And so I'm trying to manipulate tissue, bring oxygen to tissue, and I think a lot of that, and then giving your brain like space for everyone out there who's A-type personality, stressed out, hustling, like me.
Alright, so now we're going to move on to treatment area number 4. And later on we'll get some before and after pictures of Josh up on our social media accounts.
Sure, yeah. I think if I'm not sure if we're able to take the live video and like maybe in the comments, like put some before and afters, if they'll let us do that. I don't know, we'll have to check it
I
out.
think you just have to hold it up to the screen. I don't know if you can. You might be able to, because you can repost it. Like I'm posting mine.
I'm not familiar with all of the rules of the live videos on YouTube, so we'll just have to see what we can do. It'd be nice if people watch this in the future, if they can see the before and
Are we
afters.
still getting questions or anything?
We are having, Siobhan's would like us to help her find someone that looks like Josh. So if we have
So this is
a
about
single
Josh's dating
person
profile.
that we, this is, you know, she's just trying to make a love connection today. Siobhan is here for it. So I told her I'd have to think about it and get back to her because I gotta run through all the single guys in my life and see if any of them are Josh looking. Can you ask Josh?
I know.
Oh,
I don't-
I am a boy. Oh, well, that's interesting. Okay, well, maybe that changes.
That
That
does
changes
change
the we're gonna have to think of somebody that is the yeah. Okay.
Yeah, the
This is
DC
interesting.
community is filled with guys who look like me in their 20s and 30s who are
That also likes.
attracted to other men.
Okay, well there we go. Maybe
Just
DC would be your
Tell them to just sign up for Vita Fitness in U Street.
Vita Fitness on U Street. Okay, there you
Is
go.
he in India?
That's what he says.
Oh yeah, that's tough.
I don't know how we're gonna pull this off for you,
Yeah.
Shivansh, but I wish you well.
Long distance relationships are special.
Yeah.
Alright, so we got one more treatment area after this. So we're putting the serum, we're gonna drive it in again. You know, paper towel.
Yes, please.
There you go.
So Dom T wants to know, why does Josh need the hair treatment?
Yeah,
Why does Josh need the hair treatment? Josh, want to
we
explain?
need to. Well, so I'm very blessed in that I don't have a receding hairline, but I am drastically thinning in
On the crown here.
on the crown. And so we're hitting 4 spots. It is thinning a little bit other places, but from this angle, it looks pretty good. And so I'm very blessed with that. Like for the most part, most people don't see it, but
Like I said, we have some before and afters we can post
Yeah.
a little bit later on. From staying above him, I can see where the hair is thinning, so I'm trying to treat those areas as well, not just the major area of concern. Typically, we treat 5 areas, and we'll have a little extra serum, so the main area of concern I would go over again without having to prime.
And I realized it wasn't until someone took a picture and I saw it, and I was like, oh my, because you don't see the top of your head very often. But the time to take care of things like this is not when you lose it all. It's when you start to realize it's thinning, and the sooner the better.
Gotcha. And do you mind sharing how old you are?
38.
38. Okay, that's probably might be a common age. I don't really know what the most common age is for men to start losing hair,
I
but
think it's sooner. So
Sooner,
It's
okay.
probably, for me, it probably started around 35, and I didn't notice it till 37.
I mean, some men will even lose it during their 20s.
Yeah.
But like I said, this treatment is not just for men, women, chemotherapy patients trying to regain their hair. The one caveat I will let you know about is that it tends to bring the hair back in as its normal color.
that's good to know.
Yeah. So if your older have white hair,
Yeah,
and
you
we
can't tell. I have gray all on the sides.
and
That's crazy.
when we treat it, it will actually grow back to your your normal color.
Wow.
Yeah.
That's
Bummer, I was hoping for gray.
insane, right? No way. We're still filming. Do you need to come by? Okay.
Yeah,
It's okay.
from this angle, it doesn't look like I need this at all, but
All right. We're going to treat this area right up in here. Looks like. Yep, like this area spot right here.
Okay, Dom T's sharing with us that he started losing his hair around 26 years old. Okay, so that is younger.
yeah, I have a couple buddies that my brother actually started losing his hair in his 20s.
So yeah, this is the male pattern baldness. If after we've lost the entire hairline, then unfortunately that's too late for treatment.
It's so funny because
What? I'm sorry, you say something was too late for treatment?
If there's absolutely no hairline left and it's completely receded,
If it's all gone,
If it's
then
all
they're
gone.
not a candidate for this
Not a
treatment?
candidate, no.
Okay, understood. Okay, that's good to know. I didn't know there was that parameter.
yep, you can't work miracles.
Well, Jesus can, but you can't. We could pray for a little hair growth and then go from there. I'm telling you, this just watching you get this done is making me like sleepy.
Yeah.
A little bit. No, it's okay. It just looks relaxing.
So I get a massage every week because I just think this kind of stuff is. It's the only time my brain stops. Otherwise, it's like ideas, business, work,
Yeah, can't stop it.
to-do lists.
Hear ya. I stop and like write everything down sometimes because I'm like, it's a lot buzzing around that brain.
All day, every day. I'm like,
Yeah.
hey Siri, remind me of
Yeah.
this. Hey Siri, remind me of this. Hey Siri, remind me of this.
All right, so Dom T has a couple more questions for us. Do you need to take minoxidil or finasteride?
Minoxidil and finasteride, they're the common medications we use for hair growth. What it does, it blocks is what we call DHT, which is a form of testosterone. You can do it to help with the hair follicles. That's not 100% necessary.
Oh, okay. And then after one of these Alma treatments is when he's asking if you have to take it. So you can, but it's not necessary
It's
is
not
what you're
necessary.
saying. Okay,
Yep.
gotcha.
I don't take it. I had a reaction to that stuff. I probably used too much of it, to be honest.
And what was your reaction, if you don't mind sharing?
Loss of sex drive.
Oh, gosh. Okay, well,
And
when you
by
said
loss, I
testosterone,
mean completely
gone.
gone.
Oh, that's not fun. No, thank you.
No.
You can take it, but it's
The
not
weirdest experience.
necessary, and Josh does not recommend it.
No.
But
But if you take it in small doses, I have some friends that take it in small doses. Like, if you do it like just the spray, not the oral, like 1 to 3 times a week, lightly, just in the spot. Some of my buddies say they haven't had that experience,
Well, that's
and
good.
it's not in everybody. I had another guy who did it all the time and didn't have that experience. But for me, I was like, it was the craziest thing ever. To literally just have zero desire, like just totally gone for months.
like, I'm asexual.
and not
Yeah.
care. Like, so the desire leaves and you don't care.
Right.
And I'm like, what in the
Welcome to women in their menopause.
Yeah.
I'm sorry to throw us under the bus.
The other thing I would recommend
Yeah.
is something like the Nutrafol Fullest Hair package, so that can help too.
Okay.
Pre-treatment for head packages and continue to do it afterwards. Any other questions?
Not from Dom T.
Do you have one more vial after this?
I have one more section. I'm going to go back over the big area here.
I'm gonna do another live on my other
Sure.
Insta.
Oh, you have two Instas.
I have 4. So I got Momentum's personal training and nutrition company that I work with someone. Then I have Melt, which is my massage company. So it's just that. Then I have Josh Rash, which is like probably gonna be just speaking and stuff. I did a bunch of nonprofit stuff before.
How do you spell your last name?
RASCH.
Rash. I was wondering if it was spelled
And then
like
I
it
have-
sounded, but there's a C in there. Got
Yeah.
it. Okay.
No, it's probably Rosh. It's probably German.
Rosh.
Josh Rosh. But and then Rashofit is kind of like everything.
Like,
I thought it was a really clever name. It's my last name with it, right? And so all Rashofit is the overview of just everything I do. But then some people just want the fitness. Some people just want
the
the
massage.
massage stuff, and the massage has a very unique brand, and so I keep that very just that kind of
Branded
wellness
specifically.
brand specific.
Mhm.
Yeah, Momentum too has its own brand,
Smart.
and then Josh Rush brand I haven't really developed, but at some point that will be its own thing too.
Very good. I'll
Alright,
have to
so-
find all of your grams.
Yeah, they're easy though.
I plan the serum, get the last little bit of it to the big area here.
Here, let me.
So let me know when you're ready.
Yeah, sorry, Doc.
Yep.
I got too relaxed. You go first. We're good. Oh no, now we're good.
Now we're live. Hey everyone, Dr. Romanowski here with Josh. We're doing the Alma TED treatment for those just joining. This is a treatment to help restore hair. So we've completed most of the hair so far. We're just going back over one problem area, and we're going to finish up here.
So, and there's two, I started, I'm just going to give you a little overview of this, because it's been super helpful for me. A couple things working with Dr. Tim. So first, it's never fun to start to lose your hair, and I looked at all the different options. I tried a bunch of different things. I started to look at actually going to Turkey and do the surgery, but I'd have to be on medication. It's a long process. It's a year process, and that was not something I really wanted to do. And so with this, we've already started to see little hair growth. It's very relaxing too, so I can fall asleep. But so, first off, if you're starting to thin, or you have, you're looking for a different option other than going through, what is it called, the surgery stuff,
Hair transplant?
the hair transplant. If you're looking for something else, oh my gosh, I would 100% start with this. And yeah, we're already seeing some results, so we'll show the before and afters. But the way I got connected with Dr. Tim, I kind of told this story earlier, is that I was one of those guys that really just avoided going to the dentist, avoided going to the doctor, just because it's such a hassle. And in my business, it's a hustle. You're working with clients from 4 a.m. to 7, 8 p.m. at night, and so you have hour windows here and there. But if you have to go to urgent care, you go to the doctor. It's a whole thing. It's a whole process. And working with Dr. Tim, he ended up becoming my primary care, and I can just shoot him a text. And so if I have a skin breakout, if I need, if I get a sinus infection or something, I can just shoot him a message. Or if I can take a picture of something, and if it's something not serious, he calls something in right away, takes care of me right away. I pay a monthly subscription. My buddy got me turned on to him, and it's been really the most amazing experience. And sometimes we go weeks where we text every day, and sometimes we go months where we don't have to text at all. And it's just been that is honestly, even more than the hair stuff, that's just been so amazing. And so I also get my TRT through him, and hormone therapy and blood work, and it's just been, I can't promote this enough. You're probably stuck with me the rest of my life, Dr. Tim.
I know. Hope you like him.
So, Anyway, I just thought that's a cool plug for all you
Yep.
guys out there. If you don't have a primary care, I think that's the most valuable thing about this whole process. And then, you know, and then I can explore other things that I need taken care of. So, anyway.
Yep. So here at Warrior Medical, here to help you. If you're interested in the TED procedure or primary care or even hormone replacement, you can visit us online. It's warrior-medical.com. Give us a call, and we'll see you later.
Wow, look at all these people that are not at work that are hanging out.
Maybe they're at
All
work.
right.
I don't
So
know.
we'll
Who
be
knows?
doing another live stream a little bit later on today, demonstrating our Alma Harmony, the clear lift procedure, and another one doing tattoo removal. So we'll see you a little bit
I
later.
don't want that one.
You don't want that one.
Thank you, Dr. Tim Romanowski with Warrior Medical Group in Annapolis, Maryland. I don't know how to stop this video. Here we go.